4, 3, 2.
Good afternoon, everyone. I am Chandra Jackson, an epidemiologist and research associate at the Harvard Catalyst Clinical and Translational Science Center. It is an honor to introduce the accomplished and tenacious Mr. Sam Kass. Known as the White House chef who wears two hats, Sam Kass is a native of Chicago and graduate of the University of Chicago, where he majored in U.S. history. During college, he took a job cooking at the popular restaurant 312 Chicago, leading him to study under chefs around the world. And in 2007, Kass opened his personal chef company, Inevitable Table, which focused on serving healthy and nutritious food. He then became the personal chef to the Obamas while Barack Obama was a senator in Illinois. Upon President Obama's historic election in 2008, the Obamas chose Sam Kass as the family's personal chef at the White House. In addition to cooking 5 nights a week for the first family and serving as senior policy advisor for nutrition policy, Sam Kass is the executive director of the First Lady Michelle Obama's Let's Move campaign, for which he was a chief architect. With 70 private partners and the involvement of a dozen federal agencies, the Let's Move campaign aims to reduce childhood obesity. Mr. Kass has also assisted Mrs. Obama in creating the first major vegetable garden at the White House since Eleanor Roosevelt's Victory Garden during World War II. As a White House intern during the Obama administration in 2012, I had the incredible, unparalleled opportunity to work with Mr. Sam Kass and his colleagues by providing public health evidence to support the program decisions at the Let's Move campaign. So I greatly admire your accomplishments, Mr. Sam Kass, and we're very grateful that you're here to speak with us about your leadership as well as your efforts to create both domestic and global diplomacy through culinary initiatives. Before I turn the session over to our moderator, Dr. Jay Winston, please join me in giving Mr. Sam Kass a very warm welcome to the Harvard School of Public Health and to the Voices in Leadership series.
It's going to be tough to compete with that introduction. You were good.
Yeah,
And
I will say she was a rock star.
Oh,
in
yeah.
China, but she was there.
And I want to say hello as well to those of you in the overflow room. I hope you'll feel a real strong part of this, even though we can't actually see you. So, Sam, thank you so much for coming today. And you know, this is a series about leadership in particular, so we're not going to debate back and forth the ins and outs of trans fats, et cetera, but what we're interested in learning from you is, you know, what makes you tick? How did you get from public school in Chicago, where I understand your father is a teacher as well. Still is, good. To the East Wing of the White House. So maybe we could start, if you would just, in a little bit greater detail, kind of trace the arc of your career from high school and a love for baseball initially to nutrition, cooking, and the White House. And we'll take it from there.
All right, I'll try to do that as efficiently as I can. Well, first of all, it's just great to be here, and hello to everybody in the overflow room. Through high school and really through college, all I wanted to do was be a professional baseball player. And when my mom would ask me, well, what else do you want to do? What's your plan B? I would tell her that I didn't have a plan B, that if I had a plan B, there's no way I could make it. It was hard enough to make it to the major leagues to begin with. So, you know, I was sort of all in. Went from high school to a junior college. I think I was still the only person who went from a high school to a junior college ever, and to try to make it. Went to Kansas City for a year, then transited to a school outside Chicago, trying to get drafted. I was good, but I realized I wasn't better than all the other guys, and decided I need to get a better education. So I applied to the University of Chicago. That's the only place I applied, and in retrospect, that was a really crazy thing to do. But it worked out, and sort of applied the work ethic, determination that baseball had instilled in me to studies. In some ways, for the first time, and with that kind of intensity. So I was there. I majored in U.S. history. Always loved food and sort of was interested in it, but never had any notion of becoming a chef or working in the field. I just wanted to learn how to cook for my future family whenever it would come one day. So I got a job in a restaurant one summer. I was told my friend's boyfriend at the time that I liked that one day I'd go to culinary school, and he said, well, why don't you just save your $80,000 and just come hang out in the kitchen with me. And so I did, and loved it. And then when I had one semester left, and I got into an abroad program, got waitlisted into that abroad program actually, and sort of knocked down the door of the dean of the abroad program and sort of pleaded in no uncertain terms that I would promised him that I would make the most of this opportunity. He just had to get me in somewhere. I didn't care where I went. So I ended up going to Vienna.
There's a leadership lesson in that.
There's a couple
Really
of those
important,
moments
yeah.
throughout which we could probably go back to.
Yeah.
Got to Vienna, sort of said to the head of the program in Vienna, I'm interested in food, like maybe I could hang out in a pastry shop because there's great pastry here once a week or something like that. Health really wasn't on the radar at that point. And the head of my program, this is actually the connection, the head of my program's husband's uncle's friend from college, son, rode bicycles with the sous chef of the best restaurant in Vienna. And so that's actually what it was. And the third day I got to Vienna, I met this crazy guy who became a lifelong friend. Fourth day I was in the kitchen, and I just never left. So I stayed there for about 3.5 months as I finished school. So I would go in the morning, work the lunch service, race to the class between 2 and 4, which is when the restaurant closed down, then race back to the restaurant after school to do dinner service with them, work till midnight, maybe have a beer or two after, because that's how they do it in kitchens, particularly in Vienna, and then go to bed at God knows what hour and wake up and do it all over again. So I did that for 3.5 months, had to come home because I didn't have a visa, tried to get a visa. That didn't work out so well, so I just went back without a visa.
Another leadership lesson.
Another leadership lesson. We can get back to that one. So I worked there for about a year before I was asked to leave, not by the restaurant. And then I basically spent, so I got trained sort of old school, throw you in the fire, read, work your butt off until you figured it out, failed a lot. And then, which in a lot of ways was very much like baseball. Cooking in that kind of environment is just like sport. You have to perform every day. You're a player on the team, but like if you mess up, just like baseball, like everybody knows you messed up. And it's just grueling physical work, but it's also mental, and confidence has a lot to do with it. Trusting your skills and your movements and your abilities. So then I traveled, basically cooked and traveled around the world for the next sort of 3.5, 4 years, studying all kinds of aspects of food as I went. Both the culinary, but then also much more political. I spent a lot of time in Mexico studying corn and the systems and the history of corn and the systems that were in play. And then so basically spent about 5 years out in the world, was kind of ready to not be flat broke and just traveling with a bag on my back. And so went to back to Chicago, got reconnected with the Obamas, and so the rest is history.
But how did that reconnection happen?
I'm from the same from Hyde Park, so it's a small community, and sort of through the grapevine, the First Lady heard that I was back. I'd known her sort of a little bit in high school, and it was right when the campaign was starting, and they needed just a little help with the kids, because the kids were quite young, making sure they were getting some just decent food. They had no support back then. One guy helped with some few things, but that was it. It was just them and grandma. So started helping, but I'd been working and studying. I'd put down the cookbooks and had been studying sort of food policy books for years at that point, and then really sort of dove into all the issues around food and health and what was really going on in the country. And as you learn how to cook, you start asking the question where your food comes from, and you see all the farmers bringing food in, and you quickly start thinking about the implications of what you're buying and who's it coming from and how it was grown. And you look out in the kitchen and you see it's pretty clear there's a lot of issues that we're facing around health because of what we're eating. And as a chef, as you're putting food down on the plate, that becomes apparent about, okay, what are the implications of what I'm serving to the people who are consuming it. And so that set me very early on, in the beginning of my training, sort of on a path of really trying to explore those questions. And yeah, away we went.
So away you went. So he wins the election.
He wins the election.
And go on. One day you woke up and you were in the East Room. And
well, you know, these are issues that the First Lady really has always cared about as a mom, and somebody who's cared about health for a long time, worked at the hospital in the University of Chicago. And she was grappling with these issues as a mom. And so we had talked, you know, at length about all these issues. And you know, she really wanted to work on realizing that if she, you know, a woman who was well educated and had plenty of resources, was struggling with how to feed her kids well, parents across the country most certainly were, and obviously that's true. And so the idea was, let's plant a garden and see what the response was. You know, we thought that could be a very powerful way to symbolically step into the issue and see how it went. And from there, if it went well, we would really take on a broader campaign around childhood health. And that's basically what happened. It was the first thing we really did when we got in. It was incredible success, not just domestically, but also internationally. It was quite interesting. The response across the world was phenomenal. And, you know, from there, you know, basically Let's Move was born.
yeah, so with Let's Move, I mean, the First Lady eventually settled on her signature initiative as childhood nutrition and fitness and obesity prevention, and probably because she understood that it's a non-controversial issue. Everyone wants good child nutrition. There'd be no controversy or opposition to what she was about to do, right? Turns out that and that's part of what we want to talk with you about today. It's one of the most highly contested areas. Interesting to me is that and I think there's a broad consensus within the public health community that the First Lady and you, through Let's Move, have made really important contributions in changing the conversation, really, to focus attention on the linkage between nutrition and health, and the future good health and development of our children, all going back to their early and then childhood nutrition. So, and I think as well that some of the most significant achievements that you all have had, interestingly, have been with the private sector, with the commercial sector. They've been remarkably responsive in a lot of ways, and some of the difficulties that you've run into has to do with the public sector. But maybe it would be great to hear your short list of the most important. I mean, recognizing that that Let's Move is still, the jury is still out on the ultimate long-term success of it, but that there have been really important achievements to date. What would you list as the most important, concrete, specific achievements?
Yeah, absolutely. Before I get to that, I will say that we were under no false pretense. I just want to be clear that what we were walking into. Right. And we worked very hard to position the issue in a way that was very difficult to attack, which is part of the reason the message around just focusing very closely on childhood obesity was the one we picked. But it is hard to be against getting better health for kids, which is why part of the reason why we've had such great success was because from the outset we worked very hard to put ourselves in a very strong orientation to what is wildly controversial issues.
Yes.
So I just want to be clear.
Oh, yeah. That
a
was
lot
my
of times,
attempt at humor. So.
no, I understand, but it's well, it is funny to me that a lot of times people try to characterize her work as she took on this sort of fluffy, nice, easy issue, and it's like I can't think of many that are more complicated and more difficult to navigate with more interests who have a stake in ultimate outcomes here. In terms of our most, sort of our top accomplishments, I mean, there's some very specific ones and I think broader ones that are a little harder to have real metrics around. But I think first and foremost, we've moved the issue. I think the First Lady's played a huge role in moving the issue from more of a advocate, expert conversation to squarely in the mainstream consciousness. And I think you're seeing, you just see this in this sort of discourse, everyday discourse, all the time now. And I think she's been very effective at speaking about these issues in a language that people understand. And we've also worked very hard to bring this issue to where people are, as opposed to expecting everybody to come to us. And where we are, we need to bring these issues to all the areas and places and TV shows and programs that people are living. And we're going to be much more effective. So I think that's been very effective. The work in schools has been transformative. I think we're seeing right now junk food is out of schools, like today. Chips are baked, and there's no sugary drinks, and there's no candy bars in schools. I mean, that's a big deal, above and beyond the increased standards around the food that's served at school lunch and the marketing that no longer can be marketed at school. So
I wouldn't have put money on those achievements having occurred, but they did.
They did.
A remarkable breakthrough.
Yeah, huge breakthrough. And we're not going to see, to your point, the results, particularly in the data, for years. I think it'll start showing up 3, 4, 5 years from now. But it's a game changer. So that's a big one. I think we're making a lot of progress with the private sector. There's been some really big collaborations that I think are going to be big. The work with Walmart was, I think, transformative in lowering the cost of fruits and vegetables, lowering the cost of whole grain or the healthier options like low-fat milk or whole wheat bread, which before people had to pay more for, and they had to choose before price and health. Reducing salt by 25%, reducing sugar by 10% across the whole store, not just their products, every product. So that has an impact across the whole supply chain. The work on marketing, we're doing a big thing with Sesame Street, or our marketing of water. The Drink Up, You Are What You Drink campaign has shown a shift, about 3% increased consumption for people who've been seen the marketing of a healthier product. Marketing in general is just a huge issue. One that we have a long way to go on, both in, and this is where I think leadership comes in, about how do we pressure and push on limiting unhealthy marketing to kids. And some companies like Disney have done transformative work on making sure that none of their assets are being used to promote unhealthy foods to kids. But then also, how do we promote and market the healthier options like fruits, vegetables, whole grains, to compete with the marketing of be happy, drink or eat me and be happy, as opposed to we've been saying, broccoli is vitamin B, you should be so excited about it. Here's a pamphlet. It's and so I think figuring out those areas where we can really make progress. So I'm very proud of that work. So we're doing well. There's a long way to go. But I'd say the last thing I'd say to answer that, I think she's been able to facilitate an incredible amount of energy and activity that's really transcended Let's Move, that is happening in all kinds of ways. I mean, we just bump into it in cafeterias or in community centers where somebody's just sort of seen this and have just went to work and is doing all kinds of amazing things. And that's the kind of thing I can't tell you, I don't have metrics exactly on that, but that's the shift that's underway, and it's quite exciting.
A movement.
It's a real movement that's happening.
So how do you organize your work? I mean, you work out of the East Wing of the White House. You have you're taking on a lot of vested interests who have millions and millions of dollars to spend. What's the size of your staff, for example, in this David and Goliath situation?
So we are at we are a mighty team of 4, myself included,
Yeah.
and an intern, which is I've never had this much staff.
Wow. Yeah.
So I'm like feeling like a king right now when it comes to that.
Does that 4 include the First Lady? Probably not.
No. She's in her league by herself.
But you've got the bully pulpit, and you've got.
We have a big bully
First
pulpit,
Lady.
and I will say that this is an administration-wide effort. So there are people in the Domestic Policy Council that are working on these issues. At USDA and HHS, devote a lot of energy and resource to this. But across the whole Department of Defense, Transportation, lots of different agencies, Interior, have a real stake in a healthier country because they're all dealing with the symptoms of an unhealthy country, right? And so working to get to the root of that is vital to the long-term sustainability and prosperity of the country. So we have real buy-in across the administration.
A staff of 4 is actually, I think, a magic number. It's what we had here at the Harvard School of Public Health when we set out to import the designated driver concept from Scandinavia to the U.S. And what we did was we leveraged relationships on the outside with all the Hollywood studios and the TV networks. So we actually had a massive budget to bring to bear, although it was the bully pulpit, not like the First Lady, and the power of those relationships that we had to rely on, budgets that we didn't control, but we needed to tap in order to achieve the visibility that we were able to do. We're able to generate about $100 million per year in airtime for the message. The First Lady can do almost that much just with the flick of a switch if she decides to make those appearances. Yeah. But say a little bit about the messaging challenges around the complexity of the nutrition area in contrast to the narrow focus of the designated driver message and how you've grappled with messaging over the last few years.
Yeah. I think it's one of the great challenges of this space. I think in all the successful like designated drivers, seat belts, other successful sort of campaigns that have shifted the culture around any of those things. It's been about one very clear action: smoking, don't smoke. Whereas food and nutrition is much and exercise is much more complex and much harder to capture. What is a healthy way of living and a healthy diet in a line, and so you want to. I mean, we've been very careful to not, reduce this issue to like one simple sentence or target one food because it just leaves out everything else. And I think there's no magic bullet. We love to look for the magic bullet here. If we only would just stop eating this or stop doing that, or this one thing would be solved, everything would be fine. And the fact of the matter is obviously it's just not true. So we've tried to work, though, to distill very simple messages that if people can make those changes, and we also say the same things to companies, we will go a long way towards solutions. So My Plate was a real attempt at that. If you look at the old pyramid, I mean, you look at that thing, you're just like, God bless it. I'm not trying to diss the pyramid, but it was a complicated piece of business in and of itself. And you look at it, you didn't know, I mean, what is this? The person's climbing up, or are they supposed to eat the fats coming down? I mean, I didn't understand. So we tried to really simplify it, and we had a few key messages, like fill half your plate with fruits and vegetables, drink water and not sugary drinks, enjoy your food but eat less. First time the government has ever recommended eating less food. Those kind of very clear things that we have worked very hard to sort of pound and break through on just some simple things. That if people did those basic things, we'd be in a far better place. So we're making progress, but we're still learning. And this is a conversation that is going to, for stakeholders in the issue, that's just going to we're going to keep working and learning and testing and doing a better job at. I will say, one thing that I've learned is that the more we take a marketing approach around these issues and try to market these better behaviors, market through like an emotional connection, a healthier way of life, the more successful we're going to be. The reason why billions and billions are spent on marketing is because it works really, really well. Right. And I think if we're going to offset a lot of that, we're going to have to take the same kind of approach. So that's, we're working hard on that.
Yeah. So our previous Dean Barry Bloom actually rewrote the mission statement of the Harvard School of Public Health, which initially talked about research and education, he added communication
Yeah.
right up there with it as the third pillar,
Yeah.
recognizing that without effective communication, we can't do effective public health. So, but kind of in your position, you're interacting with and dependent on, in a lot of ways, the Department of Agriculture,
Yeah.
the FDA. You're interacting with the advocacy groups
Yeah.
from lots of different industries, from the potato industry to the beverage industry to the frozen food industry.
Yeah.
They're all organized separately, and they all have their own interests,
Yeah.
and they all have relationships directly with Capitol Hill, so that when the Secretary of Agriculture shows up at an appropriations hearing and Senator Susan Collins from Maine appears, she walks in carrying a head of lettuce and a potato. And she waves the potato at the Secretary of Agriculture and says, "What do you have against the potato?" Which the farmers in her state are making their livelihood from. So it's a contentious area. And when you wake up in the morning, kind of, and you look at that BlackBerry that you're still carrying, that BlackBerry Bold, I've got one at home too. How do you organize yourselves to plan for the longer haul when you're faced with all of this incoming fire from a lot of different directions?
You know, I think it's important to understand that once you have the responsibility of solving some of these problems as opposed to critiquing the situation, your orientation switches from what you hope it to be to starting from what it is and where we are. Like it or not, we are where we are. And the question then becomes is what steps do we need to take to get ourselves to a better place, to where the public health is greatly improved, to where we're protecting the interests of kids. And that is sort of the core orientation. That's like the starting point. And basically, you step back and look, where are there opportunities? Where's the fruit ripe? Where are there opportunities that for a certain set of dynamics, there's an opportunity to make a lot of progress here, be it a policy play, be it a partnership, what have you. And I think it's also important to know, to remember that there's going to be times where we agree with certain groups on certain issues and can work together, be it across the aisle or with a business who's got an interest in a certain set of things. That on this, we totally agree, and we think we can make some real progress here that we believe genuinely will help people live better lives. And then on this other issue, we're going to disagree, and we may really battle it out behind the scenes or in the public square. And that's okay.
Or you might decide to sidestep a particular battle for a period of time in order to make progress elsewhere. You know?
Absolutely. Sometimes as much as people equate like a fight with commitment to an issue or willingness to take it on, sometimes and oftentimes it's just not strategically the smart thing to do. Because you end up then just fighting for the sake of fighting. People feel very good when there's a lot of pointing and yelling back and forth, but it actually is not accomplishing anything. So sometimes you got to draw hard lines where it's important. We've drawn a very hard line around school nutrition, for example, and we have no intention of wavering at all on that. Continue to provide flexibility where it's appropriate and where it's needed, but not to roll back. But in other things, it's not ready. We're not in the right place for that, battle. Or maybe with some time, we can work to get to a place where there's common ground where we can take care of the majority of the issue we're trying to solve. May not be perfect, but we can make tremendous progress much more quickly than if we tried to fight for the next 5 years to get to a certain place. And I think part of what, my job is, and people who work in the White House and across the government, is balancing all those different issues and constituencies around an issue, identify those places where if we came together we can make that progress, and select, getting input. I think a huge part of it is working with people along the way and soliciting input and buy-in from the beginning and get a real understanding of what's driving anybody's interest. I mean, I don't want to, not to go back to the example because we don't need to talk about that too much. But the issue around potato farmers is real. I mean, those are people's livelihoods,
For sure.
and it's not that goes in conflict at times with other, that's just one example. There's a lot of those. But these are, issues that you got to balance and weigh.
Looking ahead, including to the time when the next president is sworn in, I hear tell you you'd like very much to stick with these issues for the longer haul. What do you have in mind?
If you have any good ideas.
I also understand the First Lady wants to stick with them for the longer haul.
This is something that she came to the White House living and working on and breathing in her own life. It's something that I think she intends on working on, for many, many years. I do as well. I think there's, I think policy is just one part of solving this problem, and I think in the end what we're talking about is who we are as a people, right? I mean, this conversation is what we eat and how we live goes to the very core of our of who we are, who our cultural identity is, and that change is changing it within that context is what's permanent. And policy sometimes will lead, but most often it'll follow those cultural shifts, and the culture moving will create the space to then do school lunch, right? We didn't just come in and do it. Like, it wasn't, people have been working on that for a long time, decades, and the country was starting to wake up to that. And I think we were able to help catalyze and really get behind it and push forward as we, worked with a lot of groups and parents. But it's that relationship that's important. So I'm going to continue to look for opportunities, and I know the First Lady will whenever, when we leave, to continue that push and that shift, both in the policy world, but also in the cultural realm, which is why you've seen her on Jimmy Fallon doing mom dancing and all those places, because that's a huge part of making this fun and enjoyable and something that we want to do.
I'm glad you're going to stick with it, because a lot of us in public health see the First Lady and you as genuine heroes of public health. So thank you for everything that you do.
It's very kind.
But before opening this to Q&A, tell me about the fig tree.
the famous fig. So the fig tree. The fig tree is my baby, which is now all grown up. So we got this fig tree from Thomas Jefferson's Monticello, and they had passed. I don't know if anybody's been to Monticello, but it's beautiful, and Thomas Jefferson really helped completely change our whole orientation to growing food. He really was one of the first to at least document, anyways, seasonal farming, right, where we weren't fighting nature. The European approach was very much always fighting nature and trying to conquer nature, and he sent his emissaries out across the world to bring back, with the direction of bring back seeds from all over the world. And they smuggled seeds illegally often at times from all over the world. And so he started learning to plant cool weather crops like lettuce and spinach and broccoli in the spring, and hotter things like okra and sweet potatoes and other, various other crops in the summer, and then back to the cool. So anyways, you see that all in Monticello, and they had this fig tree that they still grow there, that he grew. And so we got a little baby one. And so we planted it in this bed and had mint around it, and we have volunteers that come to help weed once a week. And I went down there, I was checking on this fig. I don't know why, but I just really was attached to this fig, checked on it like daily. This was our second year there, and I went down there one day and it was just gone. And so I had this moment of panic. I look up at the compost, we have a compost in the White House, and ran over to it, and there it was laying on the top of it for 2.5 days. So I replanted it, and it was really upset with us and would not grow at all for another year. But now, I would have been mad. I would have been mad too. I mean, I don't know what to tell you. And then it's just taken off ever since. Okay. And we just had this huge fig harvest this year. It was unbelievable, and the figs were amazing. Cool. So it was fun. We have fun out there.
I guess. Questions? Don't be shy. Yeah, there's one. And then in the front. Yeah.
Hi, my name is Kaffee Dixon. One, I'd like to thank you and to let the First Lady know I am an achievement of the MOVE campaign. I'm actually a woman of color here in Boston who, because of the MOVE campaign, decided to go into farming.
That's great.
And not only that, but take on a leadership role and encourage other women of color to go into production farming to address food systems work in urban communities.
That's great.
So as you and the First Lady move into other ideas, how do you look at increasing the numbers of from 1% of people of color that farm into larger numbers, and what do you foresee as a future role for small farming in addressing food issues?
Yeah. It's a great question. And I think it plays out on a lot of different levels.
Ask her to come see us. We'd love to say hello.
Love to come see you.
Yes, thank you.
I think community gardens and urban farms are really important strategies to augment diet in particularly underserved communities that don't have good grocery stores in them that are providing healthy food. I don't think they can supplant the grocery store, and I think we need to continue to work hard to build that infrastructure so all communities have access to healthy and affordable food. But I think those gardens are important to augment. I also think they help, and those small farms help reconnect people with their health and the connection to food, and also to the community themselves. I mean, everywhere we go, we see these gardens and farms to become sort of centers of the community. And that's a very powerful force that so much else can blossom from. The USDA is working very hard on this issue in terms of helping to encourage and incentivize more people of color to farm. We're seeing increases that are pretty exciting. And there's of course a lot more work to do. I think regional food systems, sustainable food systems, we're investing a lot of resource into that. I think it's increasingly going to be the way that has to go as energy prices continue to go up, and we're seeing great progress. So I think the key in this whole thing is there's not one way, and I think so many of these questions we try to this is the only way it can be, and I think that much more important is the sense of diversity, and I think the more diverse our system is in terms of different ways we are nourishing ourselves, both big farms and small, and the people in the middle as well, and the kind of people who are farming, the stronger our system is going to be. And I think, so we're working very hard at encouraging that. But it's going to take all approaches to overcome the challenges we have to really feed ourselves in a healthy way.
Hi, my name is Ashkan Afshin. I'm from the Department of Epidemiology. It's a pleasure to have you at Harvard School of Public Health. I was wondering if you could a little bit elaborate on the process of obtaining scientific evidence to inform your campaign.
Yeah. So the question is about scientific evidence and how do we utilize that? It's a very good question. We've worked very hard to anything that we do is evidence-based. And based on not just evidence, but the latest research that we have. It's something that has been a directive from the president across the entire administration, not just us, but we certainly have taken that upon ourselves. So we draw on lots of sources of data. We draw on government data, a lot of USDA data, a lot of HHS data. CDC provides a lot of critical studies. But we also rely on a lot of outside work. The Institute of Medicine. The Institute of Medicine is quite an important one. Their work really underpins a lot of the policy making that we do. By law, all of our nutritional guidance and policy is based on the dietary guidelines for Americans. So that is an underpinning. But we're constantly, of course, we're paying close attention to what comes out of the Harvard School of Public Health.
Of course.
But really trying to learn. This is, the science moves quickly in this field. We're learning a lot. There's a lot we don't know. And sometimes you have to make a decision with imperfect research base. And you got to be very careful in that space because the last thing you want to do is make something worse or create a new problem. So it's a vital approach, but we bring in all the evidence, we weigh what it's saying and figure out, based on that, what's the best approach to take.
Yeah.
Hi, my name is Avik Chatterjee. I'm a master's student here and a physician and a pediatrician. One of the projects I'm working on now is with a couple public schools in Dorchester, Massachusetts here, and evaluating their school food programs, and we've learned a lot of interesting things. But I met with some of the school administration the other day, and one of the big challenges they have is cost. So this school is committed to cooking all their food from scratch in their own kitchen, using lots of fruits and vegetables, all whole grain products,
Yep.
and just having healthy food for their students. But they lose money on every meal, and they're
Yep.
worried about that. Could you talk a little bit about what you think is going to happen to cost for some of these schools as they implement the USDA guidelines and try to be healthy for their students?
Yeah, I think so. Cost is a concern, and it has always been a concern, and it's a challenge for every district, no question. I think that we're getting better at it. I think part of the approach is, as we do this more, we're going to become much more efficient. We're going to learn how to purchase much more efficiently in terms of our price. We're constantly trying to find more resource. We fought for more research in the last Farm Bill. We got, it's a hard fight to get what we got. So it's going to be an ongoing challenge. What we're seeing, though, is that the districts who are doing what, as you described, who like are bought in, who care about it, and are really working at it, are really figuring it out, and they're seeing their participation go up. I think the key is participation going up, and the better the food is, the more kids are going to eat it. We've also seen in a lot of districts, and I don't know if this will be true for yours, we passed the community eligibility provision, which is a provision that basically we've implemented it, which for all schools that have 60% or more free and reduced, 40% more free or reduced lunch percentage, you can do universal free breakfast and free lunch. And that's a game changer in terms of covering all the kids who really need it and reducing the administrative costs, so more of that money can go into the food. We're making progress there, but this is just one that we're going to have to keep working through, and the USDA is providing a ton of technical assistance. There's like simple things that can be done that can go a long way to reducing those kind of overhead that's eating up a lot of the ultimate cost. Yes, sir.
Yeah.
Hi, Sam. Eric Grimm. I'm a faculty member in the Department of Nutrition. It's great to see you. I liked your point about communication being sort of where you see the greatest successes in the future. Ironically, you came from baseball, where if you watch a baseball game now, you see Gatorade and you see there's our heroes are sports figures who advertise fast food. So can you give us where you think, or where some of your best successes have been in communication on a large scale, and where you think going forward you can help change the voice around food?
I wish I had a great answer for that question, because we'd be doing it right now. Look, I don't want to just sort of sound like a broken record, but I think that is also a result of the culture that we're in, right? And I think as things change, you're going to see more and more celebrities not wanting to brand with products that are really unhealthy for kids. And that's starting to happen. I mean, I think you're starting to see a consciousness. Now, there's some big checks out there that are just huge checks, and I think that's always going to be part of the landscape. And companies are going to market their products. But people are more and more conscious of their brand as celebrities, and I think we're going to see some positive change there. I think figuring out our message on any one of these fronts about how do you communicate in any of your work, when you say what you're doing and what your goal is, like how to say it in a sentence or two so people get what they're supposed to do or they get what you're trying to accomplish, is really important. And doing it in a way that's kind of irrefutable. And we've worked very hard, and it's an ongoing an ongoing process. I think as the issue evolves, how you got to keep evolving the message. So one way that we looked at that, we started with childhood obesity, which was pretty airtight, right? And hard to attack directly. There's like a lot of side attacks, but very hard to go on directly. We've now really shifted, because of the evidence base, to talk about family health as it pertains to the child, right? That we know that children are a product and result of whatever their parents are doing, really. And so we have to think about the child within the context of their families, which includes the behavior that their parents are doing. It opens up a much broader playing field about what are the kind of things we need to do, but it makes it very clear sort of how we're structuring our message and how we're approaching the problem. So thinking through that, I think, is really vital to get that right, because it sets the whole framework of your work and what you can actually approach and attack.
In the back, I see one.
Hi, thanks for coming to talk to us today. My name is Emily. I'm a student in the Health Policy and Management Department, and I'm really interested in hearing a little more about what your focus on school health. Prior to coming here, I was a high school biology teacher in Baltimore, and we sort of tried to work through some of these issues of student nutrition, and it was a big challenge.
Yeah.
So I'm wondering, what do you see are kind of the next moves in that arena, both on a policy level and on a level of in a school for the adults that care about kids being healthier?
Yeah.
What can they do as well?
Yeah. It's a great question. And I think some of my answer will be in school and some of it will be after school. I think after school is a really critical time that we haven't spent enough energy on. I think in school, first and foremost, we have to implement all the things we've started. We have to get the marketing out because there's a ton of junk food marketing in schools targeted at kids, which is a big, big deal. We have to get community eligibility implemented, the new standards, all that stuff. I think is really important as our first go. We have a program called the Let's Move Active Schools program, which has signed up 10,000 schools across the country to help get physical activity weaved in throughout the school day. I think that's something that is designed around a champion in a school who wants to take action but needs the support and some resource to do so. So we're trying to figure out how to find those people that really care and give them the support and resources to move forward within their complicated bureaucracy in each school. I think one effort that we're working a lot on right now, to your point, is around cooking. And I think cooking is one of those things where all the things we're trying to accomplish, increase fruit and vegetable consumption, increase whole grain consumption, lower sugar, portion size, et cetera, all of that happens when people cook. But home ec is largely gone. Not entirely, it turns out. There's an association for everything, including the life sciences, as they're now called. But it's not the model that it used to be by any means, and it's not going to be. So we're working very hard on developing sort of the home ec of the future, so to speak, about how we can have a much more streamlined education program that teaches the basic skills. So I cook for the President of the United States. I basically, 80% of what I do is like 10 things. Let's just be honest, It's like, I roast, I saute, I can boil something, there's a basic couple sauces, and then the 20% is sort of the difference. But in terms of like everyday cooking, like if I'm just cooking for myself, I'm literally just doing that, right? So giving those basic skills to the right age kid, the right time, could change the trajectory of their whole lives, right? And so we're working very hard to figure out evidence-based, when is the right time, what are those right skills, and how to get it. And I think the after-school setting offers us a really valuable opportunity where this is starting to happen there already. If we provide resources in the right evidence-based sort of approach, it could be a game changer. So that's something I think as what's next, that's definitely something we're working really hard on.
I changed the name from home ec and try to go after boys as well and almost position it as cooking as a babe magnet. I bet you could confirm that, right?
I can't speak to that at all. But hold on, it's actually very important.
Yeah.
I call it the home ec of the future, and normally I will say is like, but we got to rebrand it. Like,
Yeah.
how do we talk about it? Like,
Yeah.
that's wrong. And how do we, like, right now, I'm glad you brought this up. Right now, when people think cooking, they think stress, they think dirty dishes, they think doesn't taste good, and just I don't got enough time. And the time is a real factor. So we got to figure out ways to do meals that are, efficient and fit in people's lives. But what we need people to think when they think cooking, they think easy, delicious, fun, and feel better. And
social.
And social.
Yeah.
Community, love, happiness. And love and happiness sells everything. And no, it does. That's just a marketing fact, right?
Yeah.
And I think, but that's exactly right. So we're working, actually a big part of what we're working on is like, how do we market cooking? Not educate about it, but how do we really market it? And I think that's something that right now, that's a top priority for the First Lady outside of, with the exception of schools.
Great. There was a couple, one right here in the second row, and then on the right, I guess.
Hello, my name is Yani So. I'm a master's student in the epidemiology department, and I was wondering if you could share more about what you think about the time constraint. I think traditionally the female was the more domestic, cook a lot, and with improvements in technology, you spend less time in the kitchen, and you're also working more full-time.
Yep.
So it's great if you like cooking. I enjoy, cooking, and I would like to invest my time in it to enjoy it. But if cooking and health is a major concern, but the constraints of your work environment makes you try to manage work versus family versus leisure time, how do you tackle that environment itself? Because you might want to change your family or yourself, but if the environment is a challenge, I'm curious how you could present a policy to attack that.
Yeah, well, see, it's less, I think the answers here are less policy driven, but I think part of what we have to do is make cooking fit into our lives as opposed to try to craft policies to change our lives so that we can cook, right? Because that's just not an approach that's going to work. I mean, we are where we are. And I think I have the skills to cook a really healthy meal that costs us like $1 or $2 in like a few minutes, right? It's a lot of it is about knowledge and just a basic understanding of like what is a good dish and how can you do it efficiently. Even things like, what do you start first, No, but these are the kind of things where like somebody cooks the fish and then puts the rice on, and then they're like pissed because they're sitting there, their fish is done and disgusting in 45 minutes, and the rice is just finishing up. Like things like that. I mean, we've lost a basic understanding, and a lot of people still cook, but it's still, it's not passed down like it used to be. So I think that's a huge part of what we have to do. I think the time constraints are real, and I think the answer is not, the vision is not like everybody all at home cooking these elaborate like Italian fiesta meals, right? It's like just cook one more night a week. Let's just start right there. Just one. If every family in America cooked one more time, somebody's cooking. A lot of people cooking none. Some are cooking 1, 2. If everybody just cooked one more night a week, it would have a major impact on overall consumption. And if then over time you did 2, and you ate out the other couple times, I think that would be a game changer. So it's also what's our expectations and what is the ask. And I think the ask is start really simple, and we're just going to try to add one more home-cooked family meal. And by the way, as I'm sure you know, the impact of family meal beyond just health, behavior, pregnancy, drug use, school performance, everything is increased. It's one of those fundamental foundational things that can have a big impact across many, many fronts.
In listening to you just now, I realized that your chef's hat is a badly underutilized asset, because I was imagining a series of YouTube videos, each 2 minutes long, with tips from Sam Kass reaching out to households around the country. You could motivate people.
Yeah, we've thought about that. We did actually some of that with a couple of chef friends of mine for a little while.
Yeah.
I will say the chef part in the to bring it back to the leadership frame. The one thing where that has come into play is these changes have to taste good, all of them. If we try to create a society that doesn't taste good, like we're gonna fail. I promise you that. I don't want to eat food that doesn't taste good. I know you don't. And by the way, neither do kids. Like if it doesn't taste good, these kids aren't gonna eat it. And like I don't blame you for not wanting to eat that. It doesn't taste good. So I think it's important for us to remember that. And where we're up here crafting these policies, one of the things that you always have to do, and that I always try to do, is really understand the implications of that policy on the ground to whoever it is it's going to impact. And that's your responsibility on every level of whatever the outcome is, but especially like the kid who's going to eat it, or the parent who's got to now deal with this new set of issues. And I think that's vital. And in this case, flavor gets left out a lot. But it's something that is going to be vital to the sustainability and success of this long term.
So we're getting close to time where we have to think about wrapping up. And what I wanted to ask you before we do is if you would kind of reflect on, based upon your experience, what are the particular kind of skills and personality traits, et cetera, that are essential to both surviving in the role that you find yourself in and then succeeding in it both, and kind of managing the terrain of the complexity of the environment?
That's a good question. In no particular order.
Yeah.
I think, first and foremost, you have to be optimistic. And I genuinely am. That's not just, I'm not saying that. I really believe that we can and will change and fix the challenge and overcome the challenges that we face. And I think you have to have respect for all corners of the issue. You can vehemently disagree, and sometimes it's just like, all right, there's, we're just going to fight this one out. But for the most part, having respect for even your perceived opposition on an issue, understanding what's driving them, and trying to accommodate and take into consideration those dynamics will just make you a much more effective leader in this and be able to actually move something down the field and focus more on progress and results as opposed to just fights, which we walked into a dynamic where most of it was just a lot of finger pointing about who's to blame for what. And what we tried to do is create a space where everybody had a seat at the table and we could figure out where we can move forward. I think that's important. I think you have to really care genuinely and deeply. I mean, authenticity and passion is vital to keep you going, particularly when you haven't slept in 5.5 years. That's what gets you through. And remember who you're serving. Also, when you wake up every day, I go into schools and I see these kids and you're just like reminded why you're doing it. And I would also say just, there has to be a certain level of tenacity and relentlessness, both in the outside world and sort of dealing with the issues and people and all the interests as you referred to, but also just accomplishing anything in whatever the institution that you're dealing with. I mean, be it here or wherever you go next. It's hard to get anything meaningful done for a lot of reasons. And not being discouraged and just keep pushing through smartly, knowing which battles to fight and which ones to let go, not just taking principled stands, that's key. And having patience, because this stuff, real change takes time. And we're not gonna ever accomplish all of this all at once. Like, no way. And when we do good things, we all need to celebrate them and sort of point out where else we need to go. But that momentum can continue to build more momentum. And I think that feeling that relationship and that push-pull and just sticking with it over time, taking the wins as they come, I think has been part of the real foundation of the First Ladies and our success on these issues.
It's a perfect place to stop and a great answer to a good question. Thank you so much again for coming. And please join me in thanking you.
Thank you, guys.
Excellent.
Thank you, sir.
Yeah, it was fun.